A liver disease that has sickened children in at least a dozen countries may have been detected here in Canada. The Public Health Agency of Canada says it is aware of reports of severe acute hepatitis in young children. It is investigating the cases to see if they are related to the ones in the UK and the US. The World Health Organization says more than 160 children have fallen ill with a form of liver inflammation. It says at least one death has also been linked to the outbreak. Well, for more on the incidence of hepatitis in children, we're joined now by Pediatrician Dr. Dina Kulik. Dr. Kulik, thanks for joining us to talk about this. Obviously, very concerning news for those of us with children. This seems to be affecting children from 1 to 16 years old. Have you seen any cases so far in your practice?
I have not seen any cases of hepatitis in my practice.
All right. And Dr. Kulik, what should parents be watching out for if liver disease is suspected? How is this diagnosed?
So hepatitis is a common illness, most typically triggered by very mild viruses, and many kids do perfectly well with it. They might have belly pain, vomiting, diarrhea, fever, and usually it doesn't cause significant liver issues requiring liver transplantation. And some of these children, a child that is being reported to have died from this, that part is very uncommon. But I do think that if your child is sick, whether they have fever, belly pain, vomiting, diarrhea, cough, sore throat, any viral symptom, it is definitely worthwhile touching base with your healthcare provider who can best direct your care.
All right. And when you're hearing news that the Public Health Agency of Canada is now investigating whether or not there are cases here in Canada linked to the ones we see in the UK and US, what's the immediate thing that comes to your mind? What do you think could be the source of this, given that the report says these viruses, the common viruses that cause hepatitis, have not been detected in any of these cases so far?
Yeah, so around the world, they found a few viruses that may be linked. Adenovirus is one, and that is a very common viral virus that affects kids, causing runny nose, cough, fever, etc. Very rarely, or maybe never, does it present as hepatitis. There have been some children with acute COVID infection that have presented this way, and some kids that have both. Some people are starting to think, could this be a form of long COVID, perhaps 3, 4 or more weeks after acute COVID infection? Could this be a manifestation of illness after the fact?
Yeah, I'm sure a lot of parents are wondering this connection to COVID-19, long COVID. Is there any possibility that this could be linked to a side effect of vaccines that we don't know about, in your opinion?
I think that's unlikely because there's been children as young as a few months of age that have had this hepatitis, and those kids are not eligible for vaccination. The kids less than 2 years and 4 years in lots of countries haven't had the vaccine. So I think it's much more likely related to COVID illness, if that. And of course, where they're finding the most number of cases are in countries where they've had a lot of COVID illness, such as the United Kingdom.
All right. And Dr. Kulik, going back to what parents should be watching out for in their kids, do they look at skin color, for example? Could the skin be turning a different color, such as more yellow, if there is something wrong with the liver?
So jaundice, or discoloration, a yellow discoloration of the skin, is a symptom that we see of hepatitis or liver failure or liver inflammation, though most children would be quite unwell before you're noticing jaundice. So more common would be things like belly pain, vomiting, diarrhea, and fever. That being said, there's lots of non-hepatitis gastrointestinal illness at the moment. So again, I think it's best to touch base with your healthcare provider, and they can review symptoms and tell you what needs to happen next.
Yeah, okay, we'll just have to wait and see. Lots of developments coming on this story. Dr. Dina Kulik, pediatrician, thanks for joining us this morning. Take care.
You too.